Welcome to our course on industrial ergonomics. If you've ever strained a muscle or hurt your back, you know what a pain, both literally and figuratively, it can be. We all want to prevent such injuries from happening instead of letting them happen and then seeking treatment. The focus of this course is understanding what ergonomics is. You'll also learn about the injuries related to ergonomic stress and what you can do to prevent those injuries. By the end of this course, you'll be able to recall what ergonomics is and how it applies to your work. Recognize the risk factors, signs, and symptoms of poor ergonomics. Recall ergonomic injury prevention strategies. Identify ways to work ergonomically. And recall what workers and employers can do to reduce the impact of ergonomic injuries. Have you ever experienced aches or pains from performing work activities? Your response to this question isn't tracked. Ergonomics is the study of people's comfort and efficiency in their working environment. There are people who dedicate their education and lives to this study. For the purposes of this training, we're going to focus on presenting simple information that you can use at work. You may even learn some things you can use when you're off work as well. If you'd like to review a more detailed definition of ergonomics, select the link. The goal of ergonomics is to prevent and reduce work-related injuries and chronic painful conditions by adapting work, including its tasks, workspaces, and tools, to fit the person, instead of forcing the person to adapt to the work. Ergonomics offers some general principles that can help anyone, but should also be customized to meet individual needs. For example, a taller person may need a different workspace setup than a shorter person. Failure to account for ergonomics can cause musculoskeletal damage. The term musculoskeletal refers to the muscles and skeleton as they work together. This includes the soft tissues, muscles, nerves, bones, and connecting tissues, like tendons and ligaments. Damage often occurs gradually rather than suddenly. In other words, it gets worse over time. What may start as minor discomfort that you can ignore can become much worse pain that can become debilitating. The pain associated with musculoskeletal damage is often chronic and persistent, meaning that it never really goes away, or it comes and goes with time and use. There are many different terms for musculoskeletal damage. You may have heard these examples: musculoskeletal disorder, or MSD, repetitive motion injury, or RMI, repetitive strain injury, or RSI, and cumulative trauma disorder, or CTD. You may also have heard about specific diagnoses, such as tendinitis or carpal tunnel syndrome. Ergonomic stress is a cause or a contributing cause for all these conditions. In other words, it may cause the damage or worsen it. At work, you can use ergonomics to prevent musculoskeletal damage by recognizing potential problems, taking action to prevent those problems, using ergonomic work practices, and watching out for each other and helping others work ergonomically. We'll talk about each of these concepts later in the course. Choose the words that best complete the statements about ergonomics. Risk factors are conditions that cause ergonomic stress and can increase the risk of musculoskeletal damage. Let's consider some common examples of risk factors. Repetition involves performing the same motion over and over. Forceful motion is when you use excessive force or effort for tasks such as pulling, pushing, and lifting. Stationary positions or staying in one position for too long can cause muscle fatigue and disrupt blood flow. Awkward posture happens when you bend your joints out of their natural range of motion or natural or neutral positions. Examples are bending your wrists up or down, or performing prolonged bending, reaching, kneeling, squatting, or twisting. Contact stress is when you put pressure on a part of your body, such as pressing a leg against a surface or edge. Heat can cause muscle cramps, dehydration, and can make you forcefully grip surfaces that are slippery due to sweat. Cold can reduce the feeling and blood flow in your extremities. Vibrating equipment like grinders or saws can restrict your blood supply, especially in your hands and fingers. Stress at work can be caused by fast-paced work, inadequate breaks, monotonous tasks, and poor organization. These can all cause you to work in unergonomic ways or to ignore the signs of ergonomic stress. Which of the following activities is most likely to cause contact stress? Risk factors aren't limited to the workplace. Activities like home maintenance, sports, or hobbies have risk factors too. For example, if you spend your work shift standing in one position and then lift weights at home, your body is exposed to both the stationary position at work and the forceful motion of lifting weights at home. As you may know, some tasks involve multiple risk factors. For example, straining to lift a heavy box can involve forceful motion, awkward postures, and contact stress on your hands. Anytime you combine risk factors, you increase your risk for musculoskeletal damage. Each person's level of risk will vary based on many factors. For example, the longer you are exposed to risk factors, the higher your risk. Also, consider how often you are exposed. If you face risk factors every day, you have a higher risk of injury than people who face them less frequently. Think about the intensity of your exposures. For example, if you are performing a forceful exertion, how much force are you using? More force means more risk of injury. Physical condition and capabilities can also affect risk. For example, someone who has arthritis or weak or tight muscles may be more susceptible to musculoskeletal damage than someone without those conditions. Remember that musculoskeletal damage may begin subtly and get worse over time. Identifying symptoms early gives you an opportunity to heal and to make ergonomic adjustments before the damage gets worse. Early reporting and care are critical. Symptoms of musculoskeletal damage include decreased grip strength, range of motion, and muscle function. For example, you may notice that you're dropping things, moving clumsily, or having difficulty performing daily tasks. Some other common symptoms include pain, stiffness, tingling, burning sensations, and numbness, especially in the joints and extremities. These symptoms may indicate strain in or damage to muscles and nerves. Damaged fingers or toes may turn white due to poor circulation. Swelling and inflammation are another indicator of musculoskeletal damage. Which of the following is a sign that someone may be suffering musculoskeletal damage due to ergonomic stress? Minor musculoskeletal injuries should heal with adequate rest. To treat pain, swelling, and inflammation, you may be able to use over-the-counter medications, hot or cold therapies, and gentle stretching and strengthening exercises. Seek immediate medical attention if you feel severe pain after a sudden injury. You should also seek medical help if pain or other symptoms interfere with your ability to function and perform daily activities. So far, we've been talking about what happens because of poor ergonomics. Now we can focus on how to improve ergonomics so that we can prevent musculoskeletal damage from happening or reoccurring. First, assess yourself. You can reduce the chances of injury if you exercise and stretch at least daily. Avoid smoking, which increases inflammation. Stay hydrated. Eat a healthy, non-inflammatory diet. Give any injured muscles and joints time to rest and heal. And wear clothing that is comfortable. It should keep you warm or cool and should not restrict movement or cut off your circulation. Before you begin working, consider your tasks to see if there are things you can do to make work easier. For example, can you adjust the height of your workstation or use a lifting mechanism to raise anything you will work on to a comfortable height? If there is a tool you will need to use frequently, is it in a location that is easy to reach? Is the lighting adequate so that you don't hunch towards your work to see it better? If you will have to lean around things to see, can you move the obstructions? Check the clearance in your work area to make sure you have a full range of motion. For example, if you'll be seated, do you have legroom? Make any adjustments that you can and ask your supervisor for help if you need it. Before you perform any strenuous activity, warm up by exercising gently, such as by briskly walking for 5 to 10 minutes. Doing so will gradually increase your heart rate and blood flow so that more oxygen can reach your muscles. After you warm up, stretch. Stretching can improve flexibility and range of motion. After strenuous activity, cool down by gently exercising again, such as by walking slowly for 5 to 10 minutes. This will give your heart and blood vessels a chance to ease back into normal activity or rest by gradually recovering your resting heart rate and blood pressure. Stretch again after you cool down. Stretching may feel uncomfortable, but it should not be painful. If you experience pain while stretching, stop and report it. Which of the following is something you can do to help prevent musculoskeletal damage? In addition to preparing for work, there are things you can do during work to reduce ergonomic stress and the likelihood of musculoskeletal damage. We're going to go through some ideas to minimize each risk factor. This is not a comprehensive list. Your supervisor or a safety or ergonomics professional can help you learn about specific ergonomic practices you will need for your tasks, such as lifting techniques, workstation setup, and more. One tip that applies to all risk factors is to take breaks to relieve the strain on your body. This may mean changing positions or tasks, or doing some light exercise, such as walking and stretching. To avoid repetition, break up tasks. For example, instead of spending hours on a repetitive task, plan to switch tasks at intervals so that you can use different muscles in different positions. Consider using a job rotation. This is when multiple workers take turns performing a job to prevent overloading any one person. If it's possible, automate and mechanize tasks. For example, can you use a lift to raise and move materials instead of performing repeated manual trips? If your task involves forceful motion, determine if there is equipment that can apply force for you. For example, instead of using a screwdriver, can you use a drill attachment? If you use equipment or tools, be aware that they may create vibration, twisting, and other forces you'll need to control. Instead of exerting force to lift something heavy, ask for help to perform a team lift or use material handling equipment such as carts, dollies, or forklifts. If you must work in a stationary position, consider using anti-fatigue insoles, shoes, or mats. Rotate tasks and jobs. Either trade jobs with team members or break up long jobs with shorter tasks to give your body a chance to move into other positions and use different muscles. If you can, change positions periodically. For example, alternate sitting and standing or use a footrest to give your legs a break. What is an action you can take that will improve the ergonomics involved in repetitive, forceful, and stationary tasks? Avoid awkward postures. Don't bend or twist at the waist. This includes when you're reaching or lifting. If your workstation is adjustable, raise it to a comfortable height. Place items that you use frequently at waist level so that you don't have to stretch or stoop to reach them. Use reaching tools instead of stretching up or down. To reduce contact stress, adjust equipment and workstations so that you don't touch their edges. Pad surfaces or edges that you may contact. Wear pads such as knee or shoulder pads. To maintain comfortable temperatures, wear warm or cool clothing for comfort and to keep muscles at a warm but not hot temperature. Choose appropriate gloves and protective equipment that protect your hands, arms, and body from hot or cold surfaces. Gloves can also provide traction to reduce the effort you need to hold on to tools and materials that have become slick. Speaking of sweat, consider wearing sweatbands and kerchiefs to absorb sweat before it gets in your eyes or drops onto surfaces. If you use tools that create vibration, work in shorter bursts of time instead of using the equipment for prolonged periods. Wear appropriate gloves that absorb vibration to protect your hands and fingers. Remember that stress at work can strain your body and your mind. If the pace of work is too fast, you may be able to adjust line and equipment speeds. If you are new to a job, if the job is changing, or if you are resuming work after an absence, allow adjustment time so that you can increase your speed steadily and comfortably. Stress isn't always visible, so supervisors may not be aware of it unless you report your concerns. They may be able to help you determine adjustments that will make you more productive and less stressed. Where should you store materials and tools that you plan to use frequently? To reduce the impact of ergonomic injuries, you should recognize potential ergonomic problems. Use prevention techniques like warming up and stretching. Report your ideas, concerns, and injuries. And watch out for others. In other words, if you see someone struggling, offer help. Be gracious when others offer help to you as well. Your employer should create and provide an ergonomics program. Assess, address, and control ergonomic issues. Respond to your reports. Provide you with training, equipment, and tools for ergonomics, and implement healthcare procedures. Early detection and treatment are the only ways to prevent musculoskeletal damage from becoming much worse over time. Report symptoms right away. When you report an injury, be prepared to describe when the symptoms started, how it feels, where it hurts, when you feel pain, such as after you wake up, how long the pain lasts, including how it responds to any treatments or over-the-counter medications, and what motions or activities cause the pain or symptoms or worsen them. You perform some heavy lifting at work and then play in a softball game after your shift. Before you fall asleep, you notice that your shoulder is sore. You are not sure if you injured it at work or at the game. What should you do? Report injuries regardless of where they happened. Because musculoskeletal damage subtly gets worse over time, it is often hard to determine the exact moment it begins. You may not notice an injury that happened at work until you use the damaged area at home, and vice versa. Regardless of its origin, you may need treatment and rest for musculoskeletal damage. Your supervisor can help you determine how to avoid exposing injuries to more risk factors at work while you heal and to prevent re-injury. Your supervisor can also advise you about healthcare options that your employer provides. You should now be able to recall what ergonomics is and how it applies to your work. Recognize the risk factors, signs, and symptoms of poor ergonomics. Recall ergonomic injury prevention strategies. Identify ways to work ergonomically. And recall what workers and employers can do to reduce the impact of ergonomic injuries.